Hello, my name is Dr. Jimmy Gutman. Welcome to today's lecture. Today we're going to be looking at short and long-term health issues of firefighters. Just a brief word about myself. I spent most of my clinical career in emergency medicine, but in the last couple decades have focused on this little molecule called glutathione. So although we're going to be looking at the health issues of firefighters, it's going to be from a particular perspective. First, for the sake of clarity, I'm involved in the research and development of a product called Immunocal, made by Immunotech, which raises glutathione. Second, we're going to look at these health issues and see how glutathione relates to them. Let's start by looking at some of the health hazards associated with firefighting. The obvious one that comes to most people's minds is physical trauma in the form of injuries or burns. Less obvious to most people are the emotional issues that come along with firefighting, everything from stress, anxiety, depression, insomnia, and substance abuse. With a bit of investigation, you'll also realize that there are acute medical issues like heart attack, asphyxiation, and the acute effects of toxins. But the area the general public is least aware of is the chronic medical issues faced by firefighters. These include heart disease, lung disease, cancer, and unfortunately, much more. Did you notice that the title just changed, but the slide remained the same? That's because the health benefits of raising glutathione almost completely overlaps the risks associated with fighting fires. There are many articles written about how glutathione can improve and accelerate recovery from injury and burns. Glutathione levels are lowered in stress and anxiety and depression. And when we look at substance abuse, well, glutathione is very important for the detoxification of many of these substances. But the majority of articles written on glutathione relate to medical issues, both acute and chronic. Let's get back to some of the problems faced by firefighters. Let's take a closer look at the type of exposures one might expect to see. When something burns, not only does it produce heat and uses up oxygen, but it's also full of all kinds of gases, toxic, irritant, and a whole bunch of particulate matter as well that can adversely affect one's health. The list of toxic gases you see in the slide is just a sampling of what you could find at a fire. The same goes for irritant gases. Not only can these gases cause asphyxiation, but they can also cause a whole host of other cardiovascular and respiratory problems. And problems can continue long after the fire has been put out. They can last a lifetime or even cause an early death. Most people are surprised to learn that injury and burns are not the leading cause of death in firemen. The number one cause of death at a fire is heart attack, affecting over half of all the deaths that we see at a blaze. But much more innocuous is the increased risk for the development of cancer. And of course, we can't forget the long list of different lung diseases that may occur in firefighters. How does all this affect overall longevity? Well, when we look at the numbers from Ontario, Canada, the average Ontario male is going to live to age 78. The average firefighter is going to live an average age of 65 years. This is a whopping 13-year difference. What to do? Well, let's look at some of the tools you have and some of the tools you might be missing. More progressive fire departments will offer a health and wellness program. This will address lifestyle, fitness, nutrition, and encourage regular medical checkups. This all is very much in your favor. External decontamination is critical. Everything from common sense things like cleaning yourself off at the scene to much higher tech solutions. Which raises the question, what are you doing about cleaning yourself off from the inside? Well, this is where glutathione comes in. Now, most people have not heard of glutathione, but I guarantee you this, in the next 3 or 4 years, everybody will be talking about glutathione the same way as we use words like cholesterol or antioxidant. Now, why is this? Because in the last couple decades, there's been an absolute avalanche in research on glutathione. As of 2012, there's been over 100,000 published peer-reviewed articles on the topic of glutathione. So what is glutathione? Well, glutathione appears naturally in your body, and it does all kinds of things for your health. Problem is, there are just as many things that will lower glutathione levels. Now, it's hard to raise glutathione levels. You would think that eating glutathione will do it, but eating glutathione, it just gets broken down in your digestive tract. The only way to raise glutathione levels is to eat the building blocks or precursors so your body can make more. Now let's look at some of the many things that can lower your glutathione levels. A long list of commonly prescribed drugs, poor diet, which I think most North Americans suffer from, not just from their habits, but it's hard to get good, fresh, nutritious food. Injury, trauma, burn, stress, infection, pollution, the aging process itself. You lose 10% of your glutathione every decade. The list goes on and on. The ultimate effect of all of these factors ends up lowering your glutathione levels. And as your glutathione levels get lower, you end up with cellular aging, you end up with more illness, and worst case scenario, death. So how exactly can glutathione help with these problems? What does glutathione do? Well, the easiest way to remember the 3 most important things that glutathione does in your body is to remember the word AID, A-I-D. Glutathione is aid for your health. What does this acronym stand for? Well, the A stands for antioxidant. And if you look at the literature, many authors refer to glutathione as your body's master antioxidant. I stands for the immune system, and again, the research shows that raising glutathione literally gives your immune system the fuel to continue working. And finally, D for detoxification. I tell people that next to water, there's no more important detoxification substance in your body than glutathione. Now, as I might have mentioned before, I've written extensively on the topic of glutathione. I'm going to take this opportunity to shamelessly promote my last book, Glutathione, Your Key to Health, which has chapters on glutathione in cancer, heart disease, Parkinson's, Alzheimer's, lung disease, and on and on and on. But I think we need to focus on what's most relevant to our audience today, and that is the role of glutathione and detoxification. Just look at this list of substances that are detoxified by glutathione. Everything from solvents to pesticides to herbicides, cigarette smoke, automobile exhaust. I could easily show you 5 or 6 more slides of different substances that glutathione detoxifies, and this list is ever expanding. Some of the most noxious heavy metals are released at the scene of a fire. And what's interesting about glutathione is that it actually acts as a chelator, which means it binds directly to the heavy metal, puts it into a soluble form whereby it can be taken out of the cell and eventually out of the body. The group of elements called halides, which include things like chlorine and bromine, each of these elements burning with a different color of the rainbow, but unfortunately causing a rainbow of different pathologies inside the body of a firefighter. Here's a slide depicting the biochemical pathway of glutathione's ability to detoxify halides. Now, occasionally a clumsy civilian might be exposed to a burning pan, setting up a situation that we call Teflon flu. But a burning pan does not compare to a burning apartment building. Glutathione is also involved with the metabolism of carbon monoxide, with the metabolism of complicated exposures like cyanide, with the detoxification of dioxin. For you keeners out there, here we see the role of glutathione both in phase 1 and phase 2 liver detoxification of dioxin. The truly scary thing is that we could be talking about dozens of other exposures. All that said, how do we raise glutathione? Doctors can inject you with a drug called N-acetylcysteine, which unfortunately has side effects and only lasts a couple hours. Raising glutathione using food would be nice, but it's problematic and difficult. First of all, the food needs to be fresh and it needs to be raw. So volumes of raw broccoli, raw eggs, raw milk. I'm not even sure that raw milk is legal anymore. What about just eating glutathione? Wouldn't that be nice? Except eating glutathione does not raise your body's glutathione. Eating glutathione, it ends up being broken down in your digestive tract and never making it to your cells. This is where Immunical comes in. It supplies your body with the building blocks or precursors so that your body makes its own glutathione. Immunical is the result of over 40 years of research starting at McGill University and holds many patents, not just for raising glutathione, but also for maintaining a strong immune system. This slide shows a smattering of some of the top world-class doctors and researchers involved in the development of Immunical, including Nobel Prize laureates. Immunical shows up in the CPS and the PDR. These are books that contain all the drugs available for doctors to prescribe. These books sit on the desk of every single doctor and every single pharmacist in North America. It must be noted that the inclusion of Immunical is a bit unusual in that it's not a drug, it's a natural product. A natural product has undergone the same kind of scrutiny as a pharmaceutical, having published gold standard clinical trials in some of the top scientific and medical journals available, and in some of the top institutions that you will well recognize. So what is it in this presentation that you could take home as an important message? If you are involved in firefighting, I'm sure you're trying to do everything right. What we're offering here is another option, protecting yourself from the inside. I hope you found this informative, and thanks for watching. Until next time, I'm Dr. Jimmy Gutman. To health.